Good morning and welcome. My name is Catherine Coonrod, and I serve as Senior Advisor for Cancer Moonshot Policy Coordination in the White House Office of Science and Technology Policy, or OSTP. Thank you so much for joining us today, both in the room and online, for the White House Cervical Cancer Forum. To begin our program, it's my pleasure to introduce Dr. Danielle Carnival, Deputy Assistant to the President for the Cancer Moonshot and Deputy Director for Health Outcomes in OSTP.
Thank you, Catherine. Good morning, everyone. We are so excited to have you here today. Really excited for the program and for all the conversations and action that will come from it. We're here today united by a common mission to not only effectively diagnose and treat cervical cancer, but to get us on a path to virtually eliminate this disease, which today impacts more than 600,000 people around the globe each year. Early in the administration, President Biden and First Lady Jill Biden reignited the Cancer Moonshot and set bold new goals to decrease the death rate from cancer by at least 50% over the next 25 years. That means preventing 4 million Americans dying from cancer between now and 2047. And to improve the experience by boosting support for patients, caregivers, and loved ones. We brought together the first ever Cancer Cabinet, uniting and coordinating work across everyone from the Departments of Health and Human Services and all of the parts of HHS to the Departments of Defense, Veterans Affairs, Energy, the Environmental Protection Agency, and many others. And they've been hard at work announcing more than 50 new programs and actions and investments across 5 priority areas to close the screening gap. The one that existed long before the pandemic that was exacerbated in those early days where we know equity is such a key aspect. To understand and prevent environmental and toxic exposures, such as forever chemicals and air pollution that we know can cause cancer. To decrease the impact of preventable cancers, a topic that will be a highlight today, meaning to prevent more cancers before they start by reducing tobacco use, improving access to healthy foods, and getting more people vaccinated against HPV. By bringing cutting-edge research through the pipeline to patients and communities so that all families benefit from the breakthroughs in advances to prevent, detect, and treat cancer. And to support patients and caregivers by helping them navigate the many decisions associated with a diagnosis, providing patients easy access to their health information, and driving action to lower drug costs. We've made a lot of progress. To highlight just a couple, as part of a $1 billion commitment from CDC, there's 15 million and more to come to prevent and detect specifically HPV-related cancers. That larger commitment is around making sure that grants are going to community organizations and providers in every state and tribal nations and in territories to ensure that people have access to cancer screening. The Department of Health and Human Services committed to accelerating efforts to nearly eliminate cervical cancer through screening and HPV vaccination. We're going to hear a lot about that today. PEPFAR and USAID continue to integrate cervical cancer screening and treatment of precancer for HIV-positive women under the Go Further initiative, a collaboration with the George W. Bush Institute and the Joint United Nations Program on HIV/AIDS. HHS connected federally qualified health centers with NCI comprehensive cancer centers to make sure that it doesn't stop at screening and that there's a pathway to get speedy diagnosis and treatment. We, for the first time, are providing reimbursement for cancer navigation services through a new set of codes through the Centers for Medicare and Medicaid Services and working with the American Medical Association to provide guidance around existing codes that private insurers can use so that people get the support and services that we know improve equity, improve outcomes, and even save the system cost. ARPA-H, a brand new agency to drive new ways to prevent, detect, and treat cancer and other diseases, now exists. They were here yesterday. They filled an entire room. It's great progress to see over the course of the last year and are making really critical investments in imagining a future where we can have better tools to prevent, detect, and treat these diseases. And the private and philanthropic sectors have stepped up as well with more than 100 companies, philanthropies, and academic institutions, patient organizations being part of this work. But we know that tackling cervical cancer in the United States is not enough. And that's why there has always been a global focus to our work, where, as the president says, we can lead by example. The burden of cervical cancer and many others is felt way more on lower and middle income countries, so that is a part of what we're going to be working on today. Cancer is personal to the president and first lady. It's personal to me, I'm sure it's personal to everyone in this room. It is one of the missions of their lives because of the impact it has had and the experience that they had. But it is a priority for this administration because it is personal for nearly every American family. So you have our commitment to stay with you, to continue to make progress. And I think one of the things that the president often talked about at the beginning of the Cancer Moonshot is that the reason we're doing this is because we want to show that we have hope. And this isn't hope in the abstract. It's grounded in science. It's grounded in breakthroughs. It's grounded in new efforts to make sure that we lessen the burden of cancer on the American people and the global population. I think in this disease and this conversation today, there is incredible reason to have hope. So I'm excited to see what comes of it and excited to hear, especially from our next speaker, who I think has some new news for us. But this might be her first time at the podium at the White House in her new role. Dr. Kimran Rathmel is director of the National Cancer Institute. Please.
Great, thank you for that introduction and for the introduction to the day. I, as you heard, am Kimran Rathmel, and I'm just delighted to be here. And there's never been a better time to be making tremendous advances against cancer, and this is the kind of forum that can really move the needle. So I think that cervical cancer fits the national discussion in a couple of really important ways. First, as you just heard, it's a really important part of President Biden's Moonshot program, and it also fits really nicely into the National Cancer Plan. And I say that because it's so well visualized in prevention and in early detection and in outcomes. But it also has a big part in another goal of the National Cancer Plan, which is to eliminate inequities. As you just heard, cervical cancer is more deadly in certain populations, particularly in Black populations, and the screening has been declining in recent years and is really not reaching all of the people that it needs. There are many, many reasons for this, and we will probably talk about many of them today. I'm excited to hear the discussions, but one of my other favorite goals of the National Cancer Plan is to engage every person. And that means scientists and advocates and physicians and government and every person who has risk for cancer. As Danielle said it just beautifully, this is personal for every person. And so what I get the pleasure to announce today is an initiative to take it to the individuals at risk for cervical cancer to take on self-collection, where individuals can take vaginal samples at home and send them in for HPV testing. The announcement is of an initiative called the Self-Collection for HPV Testing to Improve Cervical Cancer Prevention, the SHIP initiative. The SHIP trial network will be 25 centers. They will be announced later today, and the goal is that these will be enrolling patients in the second quarter of this year very soon. I want to tell you just a little bit more about the initiative, and I think you'll hear probably great detail a little bit later today, but this will look at various mechanisms and various assays and is done in collaboration with the FDA to make these available and is a big part of the National Cervical Cancer Last Mile Initiative. So it's really bringing partnerships across various stakeholders to make this kind of big difference that we need. There are many other challenges that people face with cervical cancer. I know we'll get into those today as well. As a part of today's program, you will hear from Jane Segerbrecht from HRSA, who's a partner of ours on the Federal Cervical Cancer Collaborative, Also from Andy Lipstein-Fristed from the CDC, Dr. Francisca Garcia from the American Society for Colposcopy and Cervical Pathology, and from Dr. Debbie Saslow of the American Cancer Society. I'm really excited for the diversity of inputs that we're going to hear about today. But my great pleasure is to introduce our first speaker. This is Dr. Kaine DeCubo. She is not at all unfamiliar with the whole of cervical cancer, which is not just a problem here, but is a problem globally. You heard the statistics about how many cases of cervical cancer there are. And the NCI has been committed to tackling cancer around the world since its inception in 1937. Our global efforts are led by Dr. Satish Gopal, who's here today, and what Dr. Emily Kaine DeCubo will tell us about is her work as the Deputy U.S. Global AIDS Coordinator for Program Quality for the President's Emergency Plan for AIDS Relief, PEPFAR. PEPFAR is an amazing resource of the national government that has made tremendous inroads in preventing HIV, but the effect goes well into cancer. And so it's a great partnership to coordinate and align efforts to prevent cervical cancer as well. I'm really looking forward to your remarks. Thank you.
Thank you very much. Good morning, colleagues and distinguished guests. On behalf of the United States President's Emergency Plan for AIDS Relief, PEPFAR, it is a privilege to participate in this inaugural forum on cervical cancer. We commend the White House on convening this forum to galvanize efforts domestically and internationally to accelerate cancer research and reduce the number of Americans who are killed by cancer by half in the next 25 years through the Biden Cancer Moonshot Initiative. Cervical cancer is the fourth most common cancer among women globally, and the second most common cancer among women in sub-Saharan Africa. Over 1/3 of all cervical cancer deaths globally occur in sub-Saharan Africa, although the region represents only 14% of the world's female population. The incidence of cervical cancer has steadily declined in the United States through the introduction of routine screening and HPV vaccination. However, cervical cancer risk has increased among women living with HIV due to increased life expectancy from highly impactful antiretroviral therapy. And this is consistent with data that shows that cancer is one of the leading causes of death among people living with HIV in the United States. Women living with HIV also have a 6-fold increased risk of cervical cancer mortality compared to women without HIV infection. And globally, the incidence of cervical cancer is highest in countries that also have the highest HIV prevalence among women. So we see a strong correlation between HIV and cervical cancer, and we're compelled to work to address these significant health threats. Nationally and globally, there are tremendous disparities in cervical cancer incidence and mortality. Here in the United States, the American Cancer Society estimates that there will be approximately 13,000 women diagnosed with cervical cancer and over 4,300 cervical cancer deaths in 2024. Black and Native American women have a 65% increased risk of mortality compared to their white counterparts. Globally, there were over 342,000 deaths from cervical cancer in 2020, and 90% of these occurred in lower and middle income countries. In sub-Saharan Africa, cervical cancer is one of the top causes of cancer mortality in women, where roughly 70,000 women were diagnosed with cervical cancer, and approximately 67% of these women died from the disease. So these numbers really paint the picture of a significant public health threat, and that's what we're here to discuss today. To address this issue, in 2018, PEPFAR began a concerted effort to invest in cervical cancer screening and treatments for women through the Go Further partnership in these high-burden regions, specifically targeting women who are at increased risk of cervical cancer. The Go Further partnership leverages the collective strength of PEPFAR, UNAIDS, the George W. Bush Institute, Merck, and Roche to provide women living with HIV with access to same-day cervical cancer screening and treatment of precancerous lesions in the 12 African countries with the highest HIV prevalence and cervical cancer incidence rates. To date, PEPFAR has invested over $200 million to conduct 7.4 million cervical cancer screenings in over 5.5 million women and has treated more than 300,000 women for precancerous lesions. In 2024, the Go Further partnership will enhance its focus on providing quality-assured cervical cancer screening for women living with HIV and scaling up high-precision testing such as HPV testing as the initial cervical cancer screening test through the screen, triage, and treat approach. In addition, in October 2023, PEPFAR announced on the International Day of the Girl Child that beginning in 2024, we will utilize our Go Further, DREAMS, and Orphans and Vulnerable Children OVC service platforms to support global efforts to increase HPV vaccination among girls. This new initiative has the potential to reach over 1.6 million girls with HPV vaccination in 15 countries and potentially avert more than 40,000 cervical cancer cases, prevents more than 30,000 cervical cancer deaths, and leads to an estimated 6% reduction in HIV incidence in this group of girls. While substantial, there is still much more that can be done collectively to rapidly increase HPV vaccinations worldwide. We appreciate the forward thinking of the White House in convening this forum to prioritize this effort. This is the kind of mobilization of commitment which is needed for success. PEPFAR and Go Further look forward to continuing our work with our domestic and global partners to innovate and collaborate for accelerated progress toward equitable access of comprehensive cervical cancer prevention services for women and young girls, thereby saving thousands of lives. At PEPFAR, we recognize that none of us can eliminate cervical cancer as a public health threat on our own. Collectively, these efforts will require continued focus and a steadfast commitment to hold ourselves, governments, and partners accountable for results. As we gather here today, I am energized by the tremendous opportunities for transformative partnerships and collaboration. Global cervical cancer elimination is within our reach, and we look forward to working with you to eliminate cancer inequities, improve the lives of cancer survivors, and accelerate progress towards cervical cancer elimination through the Cancer Moonshot Initiative. Thank you.
Thank you, Dr. DeCubo, and thank you, Dr. Rathmel. It's my honor to introduce our next two speakers. First, we will hear from Eve McDavid, cervical cancer survivor and CEO and co-founder of Mission Driven Tech. Following Eve, we will hear from Dr. Lillian Walker-Shelton, mental health counselor and patient advocate. Welcome, Eve.
President Biden, First Lady Dr. Biden, the Cancer Moonshot team, esteemed guests, and people touched by cervical cancer everywhere. Thank you so much for having me here today. I am incredibly lucky. My name is Eve McDavid, and I'm the CEO and co-founder of Mission Driven Tech, a cervical cancer innovation company. I'm a proud mama to two beautiful children, Ruby Ann and Arthur, and a wife to my incredible husband, Matt. I am also a 4-year survivor of a deadly stage 2B cervical cancer diagnosis discovered while I was pregnant with our son. Our outcomes are extraordinary and statistically unusual. If I was anyone else other than a wealthy, white Google executive accessing world-class care in New York City, our stories would have ended tragically. I am here today because 3 doctors, Dr. Balgan, Dr. Chapman-Davis, and Dr. DeBrennis saved our lives. Because of my husband Matt's unwavering devotion, and because Tamika Felder tapped me for this highest honor. Thank you. From 10 years at Google, I know technology's power to advance industry. And in treatment, I was alarmed by the dated and inequitable state of care, where women of color are twice as likely as white women to die from the same diagnosis. It was then, Mr. President, I experienced what I've heard you so often describe as turning pain into purpose. I pivoted my career to become an outspoken advocate and innovator, putting my shoulder to the wheel in the global elimination movement. It is with this urgent clarity I speak to spark change, to do what we've gathered here to do, to discuss the field's greatest challenges that, when addressed, will bend the arc of change towards elimination. This is our greatest challenge. Cervical cancer is the only cancer that is preventable, it is treatable, and it is curable. And still, survival rates have been stagnant for 50 years. By comparison, prostate cancer, comparable to cervical survival rates in the 1970s, is now at almost 100% survival rate today. This injustice is also our North Star. The prostate cancer gains are a simple combination of investment, research, and innovation. These same 3 factors that underpin another historic White House initiative on women's health research recently launched. This week, our company co-authored a letter spotlighting this simple strategy. Here's what we outlined. Number 1, investment. We must fund, at minimum, elimination. World Health Organization calculates that for every $1 spent on cervical cancer elimination, $26 are returned to the global economy. It is a great investment. It also requires a $10.5 billion funding target, and today we're pacing only 15% to goal. Number 2, research. Research and investment are inextricably linked. It's what modernizes, for example, brachytherapy, the powerful radiation procedures that cure cervical cancer. But today, the medical devices used in treatment were designed in the 1970s, relics from the past. Now, Dr. Balgan and I, as co-founders, are developing new technology to reflect the humane cancer care that women and physicians deserve. And number 3, innovation. Innovation is the byproduct of investment and research. It's the key to unlock the delta between today and every woman on this planet accessing the quality preventive care and treatment she deserves. I have dedicated my second life to my family and to this moonshot. May today be the day that we shift cervical cancer elimination from a vision to a verb in action. Thank you very much. Thank you so much. I'm so proud to welcome our next speaker, Dr. Lillian Walker Shelton, a mental health counselor and patient advocate. Thank you.
Thank you so much, Eve, for that warm introduction. I'm going to put this picture right here, and hopefully you guys can see it. Let's see here. Thank you. Thank you, Catherine, for helping me with that. So my name is Lillian Walker Shelton, and I am a licensed professional counselor and a mental health therapist. And I'm going to talk to you all today about mental health and mental health for cancer patients and also for caregivers. But I'm going to do that by telling you a story. Now, everyone at home right now on the live stream got really excited when I said I was going to tell a story, because I tell really funny stories. I did. But, you know, the story that I'm going to tell today is not a funny story, okay? It's an important story. The story I'm going to talk about today is not about my mother, who died from cervical cancer in 1996, nor is it my story, where in February of 2020, I was diagnosed with breast cancer, only for the cancer to return in June of 2022, this time on my bones, rendering me disabled. No, my mother's story and my story have been told. The story I'm going to tell you today is about this lady, my Aunt Florence. So Aunt Florence was a diminutive in stature and very timid in speech, and she was my mother's caregiver. But she didn't start out as her caregiver. She started out as her classroom assistant, helping my mother teach. My mother was a kindergartner teacher, and they were helping all the little people come into the big world. And my Aunt Florence was always by her side. So it only made sense that when my mother had cervical cancer, Aunt Florence stayed by her side as her caregiver. And so Aunt Florence would take care of my mother during the day, and I would take care of my mother at night. And if you guys have time, I would really encourage you to look at the Survivor podcast that I did last year with two wonderful people, Jocelyn and with Kristen, where I talked about the diagnosis of cancer could also give you a diagnosis of post-traumatic stress disorder. See, because when I think about my beloved Aunt Florence, I think about how, unfortunately, in 2007, she passed away from breast cancer, having a tumor in her breast the size of an orange, but she never said anything to anybody. And when my father asked her, why didn't she say anything, she said, because she saw what happened to my mother. Mental health counseling gives space. Mental health counseling and resources give validation. They give flowers. And I don't want to have to give anyone else their flowers like I'm giving my Aunt Florence her flowers now when they're gone. This is something that we should do while people are here. So if we're going to talk about the future of cervical cancer, if we're going to talk about the challenges, about the progress, if we're going to talk about things that are going to implement the vaccine, what I also encourage us to talk about today is mental health counseling for caregivers and for mental health counseling for people who are dealing with cancer. I thank you so much for your time today. Everyone have a good day.
Thank you for sharing part of your stories with us here today, Eve and Lillian, and for powerfully grounding our work. Now we will turn to panel discussions. Our first panel is focused on progress and opportunities to end cervical cancer as we know it. This panel will be moderated by Tamika Felder, who is a cervical cancer survivor and the founder and chief visionary officer of Survivor, a nonprofit organization that brings cervical cancer survivors together and helps to spread awareness, education, support, and more. At this time, I invite the first panel to take their seats at the front of the room, and I'll turn it over to Tamika.
Well, thank you all for, thank you. So it is my pleasure now to follow up after that, and I don't know about you all, those stories are what grounds us and reminds us of the work that we're doing. So I'm honored to be here and to not only represent cervical cancer patients, survivors, thrivers, and their caregivers, but also those who are not here to tell their stories. I'm equally honored to be here with a few experts who are doing work domestically and beyond that have helped shape progress and opportunities to end cervical cancer as we know it. So, Andy Lipstein-Friest, and forgive me if I slaughter any names, CDC's Deputy Director for Policy, Communications, and Lead Legislative Affairs, Dr. Francisco Garcia, Deputy County Administrator and Chief Medical Officer, Pima County, Arizona, and President-elect of the American Cancer Society for Colposcopy and Cervical Pathology, Kate Mevis, Executive Director, U.S. Federal and State Policy, Merck & Company, Inc., Dr. Debbie Saslow, Strategic Director, Screening and Vaccination, American Cancer Society, and Jane Seckerbrett, Strategic Initiatives Lead, Office of Women's Health, Resources and Services Administration. So let's get right into this. We've made so much progress. We've heard what the first presenters have said, but what are the biggest challenges left for us to address to lead us towards elimination?
Want to take this off?
Sure.
All right. Well, good morning, everybody. Really, my pleasure to be here. Andy Lipstein-Friest with CDC, Chief Strategy Officer. Thanks for the introduction, and thanks for having us here today. And just to echo what you said, I mean, about the incredible stories that we've heard already this morning, and Tamika, it's such a joy to have you convening us as one of those voices. So thank you for having this conversation with us. Challenges. There's a lot of opportunity, and there are some challenges, and maybe I'll highlight two briefly, and I know my colleagues will have many to add. So one, I think, is really thinking about screening and how we can continue to increase screening. We are seeing that how to reach the folks who are either rarely or never being screened. We know that 60% of cervical cancers are occurring in that population, and so continuing to find ways. And I know we'll talk some about the opportunities that we have there, CDC's National Breast and Cervical Cancer Early Detection Program, and other opportunities we have to really drive that up. But it continues to be a challenge, and especially those hardest to reach populations. And then we have to talk, and I know we'll talk a lot this morning about HPV vaccines, and we have already. But we are still dealing with the challenges coming out of the pandemic there. At CDC, we're dealing with this across routine childhood vaccinations. This is a big focus for us as we're thinking about our work focused on younger families this year. And the trend exists for HPV vaccine as well. And so we're seeing for the first time in a decade that HPV vaccination rates aren't increasing, and those challenges are especially acute with Medicaid insured populations. We've already been talking about disparities this morning, and I know we'll talk a lot more about that here. But finding ways to continue to ensure that we have the education and the access to drive up those vaccination rates.
Thank you.
Great. Thank you so much for the warm welcome, Tamika. It's such a pleasure to be here, and thank you for your leadership changing the course for survivors. So I'm Jane Segebrecht with Health Resources and Services Administration, and I lead the Federal Cervical Cancer Collaborative. And I think about challenges in terms of this incredible place where we are, where we can really turn the dial and change the tide of cervical cancer. We are positioned to change the course of cervical cancer as we know it and support the Biden administration's moonshot goals. We have the brain trust, we have the expertise, we have the vaccine, and we have so many incredible innovations coming down the pike right now. Between supporting guidelines that account for emerging technologies, between AI and machine learning and improved cytology, new assays, and then the potential for primary HPV self-sampling. We realize that when we are implementing these, we have to center health equity. So that's my biggest challenge, is making sure that we weave health equity through everything that we do. So within HRSA, within our health systems, which serve tens of millions of Americans in the hardest to serve communities, we center health equity in everything. And that involves listening to communities, centering patients' voices, using human-centered design, engaging in everything that we do with trust, transparency, and respect. Because we are not going to move the dial and point and chart our course forward towards elimination if we do not center health equity. Thank you.
Hi, everyone. I'm honored to be here to represent both the American Cancer Society as well as the National HPV Vaccination Roundtable and the National Roundtable on Cervical Cancer, the latter of which was launched here at the White House in response to the moonshot. To me, one of the biggest challenges is that we're still talking about the same challenges that we've talking about decade after decade after decade. So I've been at ACS working on this with many of you for 25 years, and that statistic, 50% of the people who get cervical cancer in this country have never been screened. Another 10% haven't been screened in the last 10 plus years. That's the same statistic that was there 25 years ago. So 20 years ago, yes, we've made great progress in some areas, and we haven't made any in others. 20 years ago, we introduced, over 20 years ago, HPV-based testing, and today, approximately 25% of screening in this country is still cytology alone. Where is that? It's in the low-resource areas. So we're talking about global issues here and reaching the low-resource countries, but we have low-resource counties here in the U.S. And similarly for the HPV vaccine, huge progress. I mean, what a great tool that we have to prevent not just cervical cancer, but 5 others. And yet, 20 years later, we were behind in just about every state to other vaccines offered at the same age. So I'd like to come back before 20 years from now and see some real progress.
Debbie, you nailed it, let me just say. I'm thrilled to be here. I'm Kate Mevis. I head up U.S. vaccine policy at Merck. This is a particularly exciting morning for me because, as some of you may know, I was here at the White House when, in the Obama White House, when we launched the moonshot. So it's a very full circle moment to be able to continue to contribute to this important mission. You know, when I think about opportunities from my current post, we released some really encouraging data last year that showed 0 incidence of HPV-related high-grade disease, certain studied cancers, as well as genital warts. 0 incidence in individuals, boys and girls, who got vaccinated between the ages of 9 and 15 over the course of 10 years. And I think to myself, wow, we have so much opportunity. And then I think about some challenging data that we released when it comes to HPV vaccination rates. Andy mentioned it, Debbie mentioned it. And so when we look at vaccination rates, we're seeing, coming out of the pandemic, an 18% deficit in HPV vaccination rates from pre-pandemic baselines. And those numbers weren't so great to begin with. And then I think about, okay, what's it gonna take to recover those rates? And we've done some modeling that shows it could take a decade or more. And I think to myself, we have work to do. And so what is it going to take for us to get on the trajectory of elimination here in the US, get to that 90% vaccination rate? And I'm really excited to be exploring some of those solutions with all of you here today.
It's a terrific honor to be here with friends and to be here at the White House one more time. from the local perspective, from the perspective of the boots on the ground in our communities, whether it be on the U.S.-Mexico border, whether it be in our indigenous communities of the Southwest, I got to tell you that for me, our biggest challenge is that we don't have a system. We have a series of interventions, we have a series of initiatives, but we do not have a comprehensive systemic approach to the elimination of cervical cancer in this country today. Why? Because this is a cancer of that impacts communities of color. This is a cancer of poor women. This is a cancer of foreign-born women. Those are the reasons why we don't have a more systematic approach to this. I think that what gives me courage and what gives me hope and what makes me get up every day is understanding that we have the unique set of tools in our hands and are about to have even more that could really turn the dial on prevention. Self-collection, single-dose vaccination strategies, HPV, more systemic community health worker kinds of approaches, but all those will fail unless we think of this as a systematic issue.
And where do we start putting those systems in place? Is it collaboration? Is it making sure that we all are working together and coming together, convening together? What about collaboration? I know, Debbie, that's something you and Jane everyone's big on, but top of your list, collaboration and partnership.
Yeah, and I'm really excited that just a few months ago, most of this panel and many of the people in this room and many others, over 200 people, were together at the first joint national meeting of the two roundtables that I mentioned, and I was up with the microphone and I said, we need an elimination plan in the US. We have one in Australia, we have one in Canada, we have one in the UK, we even have one in Alabama, thanks to some of the people in this room. And so I asked the room, okay, well, if we don't have a government-led elimination plan as we do in some of these other countries, should the roundtables lead this? And I'd say 90 to 95% of the people in the room raised their hand and said yes. We now have the first cross-roundtable work group on elimination, chaired by somebody in this room, Dr. Isabel Scarinci, and we're going to start right after this meeting ends to start collaborating, convening, coordinating on how we're going to eliminate cervical cancer in this country, but we can't do it by ourselves. Even all of those hundreds of organizations that are working together, we need more than a plan. We need support and funding, as Eve so eloquently said. We need to actually implement the plan that we develop.
And I love also that the plans also include having patients and patient advocates and caregivers in the conversation, because it's so important. Jane.
Great. Thank you so much, Tamika. So I'm really thrilled when I think about the Federal Cervical Cancer Collaborative, about the directions that we're making to change the course of how the Department of Health and Human Services is working together to facilitate equitable uptake of innovations in safety net settings of care. And so we created a novel partnership with the parts of the department that are leading and championing research and innovation in the National Cancer Institute and the NIH Office of Research in Women's Health, and we formed a conduit, built a bridge to the parts of the department that have national safety net systems of care, including HRSA, CDC, the HHS Office of the Assistant Secretary for Health, and CMS. And we formed this collaborative because on the tail end of COVID-19, we saw that we'd made significant inroads in the reduction of cervical cancer incidence and mortality, but we had persistent challenges that we needed to partner to better address. And so we came together as a team. There's some folks in the room here, Dr. Nico Winsenson, Dr. Sarah Tempkin. We came together as a team to think about how can we weave the goals of the Cancer Moonshot into safety net settings of care and better facilitate the uptake of innovations. And so when we talk about safety net settings and these important systems of care, we're looking at the Ryan White HIV/AIDS program, critical access hospitals, rural health clinics, federally qualified health centers, the Title X network of family planning clinics, among others. And we operate by listening to the communities that we aim to serve. And so over the past 2 years, we hosted a forum with the White House to look at needs specific to rural providers. We have supported over 9 roundtables with 450 experts. And when we use the word expert, we're talking about persons with lived experience, we're talking about patient advocates, researchers, providers who are day-to-day working with and engaging with survivors, and also policymakers. And we looked at how can we better strengthen approaches in safety net settings. And so we distilled all of the learnings into a suite of tools, including a provider toolkit, a really robust toolkit that helps providers with change management, partnerships, also vaccines, screening management. And I really like that they are high-tech and low-tech solutions. And so these are thinking about things like promotoras, community health workers, extended hours after the clinic closes, Saturday visits.
So important to have after hours.
Yeah.
It's so hard for people to get off from work, and for those of us who've had cervical cancer screenings, maybe you don't want to go right back to work or do whatever, or we need to make sure there are alternative hours.
Yeah, absolutely. So we have this provider toolkit at the provider level, and we're supporting a Project Echo at the provider level to support providers throughout the Pacific Rim and the U.S. affiliated Pacific Islands, to support telementoring and looking at anonymized case studies so that they can better collaborate. But then we're also working at the patient level, and so we're creating a suite of materials that aim to meet patients where they are. They're informed by patients. Patients provided feedback, including Tamika, on what would be most useful and meaningful in these resources. And there's a guide for engaging non-traditional partners. So that's another key in collaboration as we get into our echo chambers, working specifically in the systems of care that we support, but we need to go beyond. Yes. And so meeting patients, whether it's in a faith-based setting or in community organizations or in schools, is so critically important.
Thank you. So Andy, I want to ask you, just leaning off of that too, public health, and how do you partner with healthcare systems? How do you improve access for those to ensure that appropriate follow-up is happening? One of the things that we talk about a lot in the cervical cancer space, we get people in the door, we get them screened. What happens when it's the follow-up care? How do we get them to continue through? Because that is a big disadvantage to people being diagnosed with cervical cancer, the follow-up care.
Yeah, well, it's a good question, and we've been spending a lot of time at CDC this year talking about public health as a team sport. And I mean, this room really speaks to that, right? And so we think about the role of government, the role of, across of HRSA, of CDC. We've already talked about some of the work that CMS is doing, NIH, our colleagues across the government, working with jurisdictions, right? I mean, for us at CDC, vast majority of every dollar that's invested at CDC goes out to states, to localities, to tribes. That's how we do so much of our work. And then thinking about working with patients, with advocates, with the sort of full sort of community of voices here, and working with the healthcare system to get to your question. I mean, the linkages between public health and healthcare are so important here, and in lots of different ways. So, you mentioned screening specifically. I think, thinking about how we make sure that not just that we're increasing screening, which we've talked a lot about, but then that follow-up, right? And so that we are thinking about the structural changes, right? So that we have support for patients who are needing to access that care, whether it's hours or other supports for that. Thinking about navigation support so that patients know what to do. This is a scary time. These are scary things to deal with. And so knowing how to navigate the system, giving feedback to providers so that providers have a sense of like, how are you doing? Are your patients getting screened? If your patients are being screened, what happens to them next? And things like setting up reminders for patients so that they can know when they're due for a screening. And all of that has to happen with public health and healthcare hand in glove doing that work. Also, just to pivot back to vaccines for a minute, I mean, we see that there as well. So for us at CDC, we have a really great partnership, for example, with AAP, where we're working with them to support pediatricians to make sure pediatricians have the resources, have the information, have the knowledge that they need to make sure that when those kids are coming in, that HPV vaccine's at the forefront of what they're providing.
Yeah, and we've touched on it a little bit, and I want to go back to this health equity. We hear it a lot.
Yeah.
People are talking about it a lot. There's a commitment to do it. We're holding people accountable to being committed to health equity. What does that mean? What does that look like in the work that you all are doing? Francisco, I'd love to start with you.
You know, health equity is something that has been given a lot of lip service, quite frankly, for many years. The disparities that we see, both racial, ethnic, and economic, are not new. Health equity, in terms of this work, starts with it being kind of the central and organizing point. And that's one of the things that I'm really proud of, at least my contributions to the ACS effort, which have really sort of grounded its planning and its implementation and programming effort in the concept of health equity, making sure that everybody's voice is at the table, that women of color, that poor women, that foreign-born women have a place to speak their truth. I would also say that part of that is thinking about our own biases as a system.
Yes.
And the things that we do structurally, either actively or passively, to create artificial barriers for entry. For those of us who deal with populations that are foreign-born, for those of us who deal with indigenous populations, for those of us who deal with border populations, that is a really important concept. How do we decrease the barriers that don't need to be there? There are plenty of barriers that keep a woman from doing what she needs to do.
And in the time we have left, this really is a great time for me to also ask this. Still bring in health equity, because again, it's important and we're not just going to give it lip service, but how do we keep the momentum going to increase vaccinations, make sure that people aren't falling through the cracks, for the health disparity cracks, but also, we talked about doing this 20 years ago. I'm a 22-year survivor. I also don't want to come back here and say we're still working and we've got to push the needle even further. I want to come back and celebrate that we are here near elimination. So how do we keep that momentum going while making sure that we do check off all the things that you all have listed?
And I think that's a really important segue when we think about incremental change is not going to get us there, right? So let's talk about what's happening today when it comes to vaccines, and as we start to think about solutions. One, we know that 27 states are now using their immunization registries to forecast to providers to initiate HPV vaccination at age 9. Why only 27? What more can we be doing holistically to say if we start talking to parents when their children are younger, we have a longer lead time to make sure that their kids get vaccinated? Two, we know that states like Washington State and California are actually going to be notifying parents about the value of HPV vaccination. So they're going to be adding another touch point with parents about HPV vaccines. And three, we know that every state in the country now, it was only in 2022 where this happened, will allow pharmacists to vaccinate adults for HPV vaccines. Okay, so these are really good changes that we know are in place now, but what's it going to take to get us there when we talk about elimination and 90% vaccination rate? Well, should every state be forecasting to providers about vaccination at age 9? Probably. Should we make sure that if an adult presents at the pharmacy counter, they're not going to be charged a copay for that vaccine? Absolutely. And three, I think the point that we've all made is trusted voices are so key in this. And so how do we make sure that providers, community-based organizations, leaders in their religious denominations have information about HPV vaccines and all vaccines, to Andy's point, in a way that they can deliver that's tailored and will lead to a positive vaccine experience?
I'm going to tell you about something that keeps me up at night.
Okay.
And it's the good side and the bad side. The good side, something I'm so excited about, was mentioned is self-collection is coming. And I've been saying, I don't know when, I don't have the magic ball that tells me when, but I know the FDA is reviewing it now. And when I give a talk for these days, I say to my health system audience and all the various people that I'm asked to give these webinars after webinars for, which is you could wake up tomorrow or next month to an announcement, to a headline that says the FDA has just approved self-collection, and the negative side that keeps me up is, are you ready for it? And the answer is no, because I mentioned, I think in my opening comments, that 25% of the people in this country are still being screened by cytology alone. We can only do self-collection on primary HPV, which means the HPV test first. And do you know what % of screening is done with HPV first? 1 to 2%. So here we are, so excited that we're on the cusp of having approval and rollout of self-collection, which I think is going to be the game changer, or a big game changer for getting these 40% of women who aren't screened at all or rarely screened. And we're not going to be able to offer it to them because we don't have that in place. So we have the technology, we've made the progress, we need to do the work.
I literally could talk to you all day long. So we have a very little, so either your call to action or your final thoughts or.
Great. Thank you so much. So to your point about are we ready, HRSA is building bridges between NCI-designated cancer centers and HRSA-supported settings of care so that when there is screening, whether it's HPV self-sampling or otherwise, there is a channel for follow-up care, and that's so, so critical, making sure that patients receive support across the entire cancer care continuum, from screening all the way through survivorship. And then again, centering health equity when we are developing those bridges. And so on the first anniversary of the Biden Cancer Moonshot, the First Lady announced that we were doubling our investment in our Accelerating Cancer Screening Partnership Program, and that makes sure that when there is a screening in a community health center, there is then within 30 days follow-up in a NCI-designated cancer center, and it might be through connecting a patient to a clinical trial or further diagnostic services or treatment. But supporting them along that entire continuum is so, so critically important.
Thank you.
Well, maybe I'll just say one word which I don't think we've said yet, which is data. And the real importance of data and surveillance as we're thinking about what it means to really turn the page to a new day on cervical cancer. And all of the work that we do, whether it's understanding who is getting sick and who is dying and when and how and why, understanding vaccination rates, understanding screening rates, it all goes back to having really robust, strong data and surveillance. That's our bread and butter at CDC, but we certainly, like all of this, we don't do that alone. And so I just want to also call that out as something that we really need in place to be lifting all of this up. And to your point on a call to action, I mean, I think we all feel pretty called to action, honestly. That's my vibe in this room, with huge thanks to our colleagues at the Cancer Moonshot who have really fostered that and created so much opportunity for us. But, I think continuing to find ways not just to strengthen these resources, but that is the most important thing, but to make sure that people understand that cervical cancer is preventable, it is treatable, it is curable, but that relies on us all doing everything we're talking about today together.
And I would just like to end and say stigma. We have to stop stigma. If we stop stigma, we will prevent cervical cancer, we will prevent HPV-related cancers, because we have to make sure that the language we use, that when we're speaking about these cancers, that we remember that there is a human being behind every single data point that's out there. We've had enough, and we need to stop. And so I wish we could keep going, but we have another amazing panel that is following. I'm equally excited about that and the global chat that they're doing. I want to thank my esteemed panelists for not only their time today, but for the work that you do each and every single day. I want to thank the Biden Cancer Moonshot team convening us all here together. What an amazing group of people that we have here doing incredible work. I want to remind you of the Moonshot's aim to slash death rate from cancer by half in just 25 years and improve the lives of those living with cancer and its survivors, regardless of background or zip code. I was diagnosed at age 25. Today is the 25th. I don't know about all of you, but I believe it, I can feel it, and I know we can do it. Keep the momentum going. There are lives depending on you to keep the momentum going. And with that, I'll hand the mic over to Dr. Catherine Coonrod, and thank you all very much.
Thank you so much, Tamika. Thank you, panelists, for your thoughtful discussion on domestic cervical cancer challenges and opportunities. Our second panel is focused on United States leadership to drive global collaboration and progress. This panel will be moderated by Dr. Heather White, a global public health specialist who serves as the executive director at Together for Health, a global advocacy organization dedicated to ending preventable deaths from cervical cancer in underserved areas of the United States and globally. I invite the panel to take their seats at the front of the room at this time, and Dr. White will introduce all of our panelists.
Hi, good morning, everyone. It's really a pleasure and an honor to be with you today. And I have to say, it's really hard to follow a mic drop performance from my good friend Tamika and her panel. I know many of you do all of this a lot. We all sit on panels, we listen to panels, and that was about as exciting and energetic and dynamic a conversation as I've heard in a long time. So thank you to everyone for your remarks thus far. We're excited to share ideas, thoughts, challenges, actions that we are all taking in our respective institutions and areas around capitalizing on U.S. leadership in the global cervical cancer prevention and control sphere. What strikes me, though, thus far is really how many comparisons there are from the domestic agenda and the global agenda. And so, though we make that distinction in today's conversations, there's really so much cross-pollination and learning and insight that we can take away from one another. I'd like to start by introducing our distinguished panelists, and I will not be reading their very long and illustrative bios, but you probably know many, if not all of them, so we'll jump right in. First is Dr. Kathleen Schmaler, who is a professor at the Department of Gynecologic Oncology and Reproductive Medicine at MD Anderson Cancer Center at the University of Texas, followed by Dr. Satish Gopal, Director, Center for Global Health at the National Cancer Institute. Hannah Johnson is a Global Health Program Manager at the George W. Bush Institute. Dr. Pavani Ram, joining us from USAID as the Chief Child Health and Immunization. And Vanessa Bennett from Roche Diagnostics and serving as the Senior International Business Leader in the oncology disease area. Please join me in welcoming our panelists, and we'll get started. Before we dive in, and Kathleen, I'll start with you this morning, but I just want to say quickly, my role as an advocate, and many of you do the same work, is really to reject the status quo. To say what's happening today is simply not good enough and we do not accept it. And to me, the Moonshot Initiative and cervical cancer elimination are the perfect dance partners. They both call on us to be bold, to be inclusive, and to be action-oriented in what we're doing. And so I know I speak for all of you when I say, let's keep going. So I want to start with you, Kathleen, and ask you, MD Anderson is the largest cancer center in the world. And you all, I know, have made huge strides in preventing and controlling cancer here in the US, but I'd love to hear about what you and your team at MD Anderson are doing globally in cervical cancer prevention and control. And I'll secondly say, I'd love to hear about particular contexts and programs where you feel like there's real synergy and real momentum around elimination.
Thank you, Heather, and it's really an honor to be here today representing MD Anderson. Our work at MD Anderson on the global front is really in 3 different areas. The first being training education, the second being research, and the third being in policy. In training and education, our focus has really been on treatment, both the treatment of pre-invasive disease for the women who screen positive, as well as care for those who develop invasive cancer. So we do a lot of training around the world really related to thermal ablation and LEAP, as well as surgery for cancer. In the second area of research, we've been focused on working with our bioengineering colleagues at Rice University to develop point-of-care technologies, so rapid HPV tests that can be used in low and middle-income countries, as well as alternatives to colposcopy and biopsy, as there are not enough gynecologists or pathologists in much of the world to read biopsies, so we can find alternatives to that. And then the third is in policy and in helping ministries of health develop their elimination plans and more so in implementing them. And all this work we do in collaboration or in partnership with the ministries of health, but also with PAHO and WHO, UICC, NGOs. We have worked a lot together. And I think most importantly with professional societies. So we do a lot of work with the International Gynecologic Cancer Society, or IGCS, where we have developed a fellowship for gynecologic oncology for regions of the world that don't have formal training. Because we can do all this screening, but we're finding a lot of disease, and then if we don't have anyone to treat them, we really have failed the women. Mm-hmm. A couple of countries that we're working in, the first is Mozambique. We were invited more than a decade ago now by the former First Lady of Mozambique to help them develop a cancer control plan, as well as a cancer program primarily focused on cervical cancer. Mozambique's a Portuguese-speaking country. I don't speak Portuguese. So we partnered with many of our collaborators from Brazil and have really had this amazing 10-year partnership between the Mozambique Ministry of Health, as well as the hospital and universities there, many of our colleagues in Brazil, as well as with MD Anderson. Lots and lots of training and education, both in pre-invasive disease and cancer. And then we have an IGCS site there, and we've trained the first 3 GYN oncologists for the country. So that's been super exciting. And we now have the second class of fellows going through. We just finished a large study with the generous grant from the National Academies and USAID, where we screened 9,000 women with HPV testing, primarily self-sampling, and had a 92% follow-up rate of completion of treatment. So those that were positive got ablation, or if the lesions were too big, they underwent LEAP, or were referred for cancer care. And so we were super proud that even in the midst of COVID, 92% of those patients came back, and we met the WHO goal, primarily done by a group of amazing, amazing nurses in Mozambique. But I think back to the first panel of what keeps you up at night, it's that 8%, right, of the women that we failed. And when we look at that group, they were primarily women living with HIV, with lesions that were too large for ablation and needed a LEAP and got lost in the process, and then those with cancer. The large majority did not get the recommended treatment, and that's with lots of money, MD Anderson and Brazilian experts. So I just think having that continuum of care is so important, and we really need to build it. And I used to say, oh, cervical cancer is easy, we have it figured out. It's not easy. It really takes a lot. So I think that's, we've had a lot of success there, but we have a long way to go. And thanks to support from the NCI and others, we're continuing to look into, how do we not lose that 8%. And then the other country we're working with is Indonesia. They recently reached out to us. Many of you may know they have a very, very ambitious cervical cancer elimination plan through their Ministry of Health. And so we, along with many others, are helping to provide some of the technical support for that. We had two experts from the Ministry of Health in Indonesia visit us at MD Anderson last week, and they came to see our clinics and how we do everything. And so we took them to our safety net hospital where MD Anderson provides the cancer care there, and they were just completely blown away by the difference 10 miles away from the largest cancer center in the world, and that in our clinic there we see advanced cervical cancer every week. And then we took them a couple of hours outside of Houston. We were doing a training for providers in a more rural part of Texas, and they were just completely blown away by the disparities in our country. And although I live it every day, it was interesting to see that outside perspective. So I think we have a lot of work to do globally, but also at home, and it'll take all of us working together. And I think we would learn as much from our global partners as they learn from us.
Thank you. Thank you. I appreciate so much that perspective, Kathleen, and I'd love to hear from you, Satish, about the work that you all are doing at the Global Health Center at NCI, and particularly that issue around, yes, we've got tools today, and those tools are improving all the time, but really, how do you contextualize those tools, whether you're thinking about Mozambique or whether you're thinking about Alabama, where I'm from, or you're thinking about the Texas border, and really how do you build that implementation lens into your work?
Sure. So thanks so much for having us. And it's great to be here as part of an NCI contingent with, of course, many people contributing to the work that I'll describe. I think everyone is familiar, but the NCI is the largest funder of cancer research in the world. And we think also the largest funder of specifically HPV and cervical cancer research, probably by a substantial margin. And that effort has been historical and also is ongoing, right? And there's, I think, two main buckets to that. I think there continues to be major interest in trying to find new tools and technologies that will accelerate progress towards cervical cancer elimination. And that work really touches on every pillar of the WHO elimination strategy. So, for example, of course, development of the HPV vaccine at the NCI through work of Dr. Doug Lowy, who's been a mentor, I think, to literally everyone at the NCI, including every recent NCI director. And John Schiller, and that work is ongoing, right? There's continued optimization efforts to see if we can definitively establish that one dose is good enough, not only for people in low and middle income countries, but really for anyone anywhere in the world. So that work continues. There's also important work that's happening related to HPV-based and AI-enabled screening to make screening much more efficient at a population level. We continue to support research like Dr. Schmaler alluded to about finding lower cost, truly point-of-care HPV diagnostics, again, to support population-level programming. We've supported research that's led to the validation of handheld thermal ablation devices as a workaround solution for cryotherapy and loop excision, which are really impossible, basically, to implement in rural settings around the world, no matter where people live. And then there's increasing interest in AI to enable pathology, to enable radiotherapy planning once women are eventually diagnosed or people are eventually diagnosed with cervical cancer. So that commitment to finding the next generation of tools, I think, continues. I think increasingly we understand, and I think that's been really nicely reflected in today's conversations, is that new tools and technologies are not enough, right? That once you have them, you also have to, there's important science to be done about how best to deploy these sustainably and at scale in populations and communities all around the world. And so over the last several years, we've had a major renewed focus, I think, on implementation science, both domestically and internationally. And so this includes, for example, studies to see how we can use crowdsourcing to engage mothers in screening at the same time as their daughters for vaccination. This includes trying to integrate breast and cervical cancer screening programs, integrating cervical cancer control programs within HIV care settings, given that people living with HIV are elevated risk. This also includes things like embedding implementation research within programs so we can better adapt programs as they're being undertaken to the generation of real-time data. And I think not surprisingly, this has already been alluded to, but we've recurrently found that all of this work that happens globally ends up having quite a lot of applicability also to particular populations in the United States, and we've observed that time and time again.
Mm-hmm. Thank you for that question, for that response. And my next question is, what do partnerships look like for NCI in this space, and how do you leverage, obviously, the magnitude of your work with other global partners to really accelerate the elimination agenda?
I think the NCI is a very active collaborator, both within and outside U.S. government. I think many of those collaborations have already been alluded to today. The federal cervical cancer collaborations, our contributions to Go Further. Mm-hmm. We've helped to support the USAID peer program that Kathleen alluded to earlier. And actually, we're really grateful for the opportunity that the Cancer Moonshot specifically enables to really expand and develop new collaborations. That really is true for us at the NCI in very important ways. And so we're grateful to Catherine and Danielle and others who helped to make that possible for us. We also collaborate with many entities outside the government. Always, I think, with the appreciation that the science and the evidence that we generate has to ultimately be taken up into policy and practice worldwide. And so this includes efforts, for example, like a WHO Collaborating Center that we have held since 2016 for cancer control. Before the WHO had any cancer-specific programs, they now have 3. The first of those was cervical cancer. And so really since 2016, we've tried to always think about how we can provide scientific support to the cancer agenda at WHO as it's evolving. And we actually do to redesignate our collaborating center agreement with the WHO this year. Another good example of this is the International Cancer Control Partnership, which is a consortium that was initiated in 2012 that NCI kind of initiated together with the Union for International Cancer Control. And this essentially convenes a coalition of technical support organizations like NCI designated cancer centers such as MD Anderson to support countries as they become interested in developing, implementing, and evaluating their national cancer control plans. So they both get external technical support as needed. And of course, cervical cancer is an essential component of essentially every national cancer control plan worldwide now. And countries also have the opportunity to learn from each other as they undertake often similar challenges.
That's fantastic. And I mean, it's an incredible breadth of work that we're already doing, but I will echo what I heard someone say earlier, and I think you said it too, Kathleen, we have a long way to go. But that's absolutely important and impressive breadth in partnerships and in research and implementation. I'm going to turn it over to you. Thank you, Dr. Gopal. I'm going to turn it over to you, Hannah, to hear a little bit about what is the perspective and the role at the Bush Institute, particularly around the PEPFAR Go Further program. What have you all seen since you've launched in terms of acceleration and progress in the countries that you support? Where do you see real synergies and things coalescing? Are there particular contexts that you would like to highlight? And what challenges do you see forthcoming that you all feel very prepared and able to take on within the context of your partnership?
Well, thank you so much, Heather. It's a great question, and I'm just so honored to be here today on behalf of the Bush Institute and the Go Further partnership as well. So I'm going to take us back a little bit in time. We talked about 20 years. When President and Mrs. Bush left office, the President's Emergency Plan for AIDS Relief, or PEPFAR, was having tremendous success when it came to screening, prevention, and treatment of HIV across the continent of Africa. But there was a piece that was missing. Women were surviving HIV, but they were succumbing to a disease that was entirely preventable. You heard earlier that women living with HIV are up to 6 times more likely to develop cervical cancer. So we got started on this right away at the Bush Institute in 2010, and in 2018 we launched the Go Further partnership with PEPFAR, UNAIDS, and then Roche and Merck. The partnership collaborates with countries and governments in 12 countries across Eastern and Southern Africa. We focus on screening and prevention for precancerous lesions in women living with HIV from the ages of 25 to 49. And this work is done primarily through the integration of services that have already been in place for 20 years, thanks in part to the work that PEPFAR has done for HIV. So this allows us to be able to get access to women more quickly to be able to provide those services. And we've had tremendous success. So to date, we have done 7.4 million screenings for women living with HIV and conducted over 302,000 treatments for precancerous lesions. Thinking about a specific context, there's not like a one-size-fits-all model for countries. It definitely depends on that specific context. But thinking most recently about a country that comes to mind is Namibia. We had the pleasure, my colleagues and I from Go Further, of traveling to Namibia in August to be able to meet with providers, beneficiaries, the Ministry of Health, to be able to see what challenges they may be experiencing and what successes they have that we can learn from and that they can capitalize on. And while I was there, I had the opportunity of meeting with a nurse named Liz Ndri, who sometimes travels up to 100 miles a day to go and see clients in satellite clinics. For those of you who don't know, Namibia is an extremely mobile population. They're very spread out. And so this is typical in certain regions that may be more rural. And Namibia is finding really innovative ways to, address this challenge. One is training more nurses and via screening. They're starting a campaign to be able to do that. The other is the use of community partnerships, which we heard in the last panel is really important here in the States, but it's even more important when you think about working abroad. Liz Ndri will travel with community partners who have been in the health system for, again, almost 20 years, thanks in part for their work with PEPFAR. So they already know how to translate what we speak as public health or medical jargon to the individual. They know how to track individuals and how to bring them back into the clinic. They know how to make them feel comfortable, informed, and they've really integrated cervical cancer into that work that's already being done. And it's had a lot of success when it comes to getting women back into the clinic. So as of fiscal year 2022 in Namibia, 92% of women who screened positive for precancerous lesions received treatment. And that's above the WHO targets when you're thinking about women living with HIV. And so as a partnership, we're thinking about how we can capitalize upon that and really address those challenges when it comes to that 8% that we may be missing, and how we can use those partners that are already in place to be able to make sure women are getting the best care they can.
Thank you for that. That's a great example in Namibia, and really exciting news about your forthcoming work in HPV vaccination as well, to be able to leverage that infrastructure and those systems to be able to reach populations of young girls and adolescents as well. So that's wonderful. And I wonder, how much of what you're learning and doing and building within the programmatic context can we take beyond the doors of PEPFAR to reach populations of women outside of the women that you see in your PEPFAR clinics, and really thinking about what is that going to get us to population scale, and hopefully we can talk a bit about those challenges. Thank you, Hannah.
Thank you.
And I'm going to turn it over to you, Dr. Ram. It's a pleasure to have you here from USAID, Chief Immunization, Childhood Immunization Director, and thinking about your work with respect to not only HPV vaccine that USAID is pushing forward, but also how do you contextualize that within some of these larger global initiatives, for example, Gavi's commitment to revitalize HPV vaccine. So would love to hear about your work.
Thank you so much, Heather, and really it's such an honor to be here. I'm so moved by all of what we've heard so far today. I got into global health work because when a woman dies, it devastates a family. When a woman dies, it devastates a community too, right? And that is our key driver of our work at USAID. that need to ensure that there is equity. It's unconscionable that women are dying preventable deaths from vaccines that are highly, highly effective and yet are not accessible yet. So with that, I would say that we are working incredibly closely across a range of partners to try to support progress on HPV vaccination. It's great to carry the flag of immunization as a key anti-cancer tool, and I'm just so thrilled to be able to do that. You know, at the end of 2022, it was only about 21% of women globally that had coverage with a single dose of HPV vaccine. That's a long ways away from that 2030 target of 90% plus that we need to be at in order to achieve cervical cancer elimination goals. So Gavi, the Gavi Alliance, the Global Alliance for Vaccines and Immunologicals is what it used to be called, but many of us are partners in the room of the Gavi Alliance. We identified that many, many countries had put aside their plans to introduce HPV vaccine over the course of the COVID pandemic because public health systems were so stretched. And yet we realized we've got to get there, we've got to make progress. And so the Alliance has established an incredibly ambitious goal of reaching 86 million girls with HPV vaccine by the end of 2025. To do that, we've got to work really, really hard. And there are a number of challenges, right? So one is countries have to get committed to introducing the vaccine. Gavi's going to be able to support them to do that, but that commitment for both the introduction and the scale up and reaching girls where they are is really critical. At USAID, we're also working on our bilateral investments, meaning our work directly with countries to complement what Gavi's going to do, both by supporting country immunization systems to be ready to introduce those vaccines, to get the financing in place, to make sure that very mundane things like technical working groups actually meet and work and look at their data and look at how they're going to make progress. I think what I would say, and we're doing that kind of work in Nigeria as an example, but some of the challenges maybe that we're going to need to address, many, many girls are not in school, which is often where we're going to reach girls in that 9+ age group. While immunization programs in the countries that we support have largely been effective, I mean, this is a game changer for public health, of course, but we're very good at reaching, for the most part, young children. We're not as great at reaching children in that 9+ age group that should be getting HPV vaccine. Massive challenge. We also have a challenge with girls who are in that age group who are out of school, right? We need to reach them. And of course, for an agency like USAID, we worry a great deal about girls who live in humanitarian settings, complex emergencies, fragile and conflict-affected settings. How are we going to reach those girls? They deserve just as much opportunity to be protected from the devastation of HPV and cervical cancer. So I think those are some of the challenges that we're grappling with as we look ahead and work ambitiously to meeting that 86 million girl target for HPV vaccine.
And I know, as many folks have said in the room earlier today, you know, no one entity can do it alone, right? And so how do you leverage your partnerships effectively? How do you bring the right people to the right table at the right time, really to start to build and capitalize on momentum behind a call like Gavi's ambitious call for 2025? Would you like to talk a little bit about sort of leadership and where you see, you know, folks really stepping up to bring this to the fore?
Yeah. You know, in the pandemic, there was a phrase, shots in arms, that people used all the time, which I hated, actually, because it sort of took away the people part of that. But what I would say is that vaccination is a partnership first and foremost between a mother, a family, a child, and a health worker at every level of the health system. And so we've got to kind of start there, right? We have to work with families to instill confidence in HPV vaccine as a critical health tool. Removing stigma is a key part of that, for sure, but this is a key health tool. So working with families directly to instill confidence in that vaccine, to promote demand for that vaccine across all layers of the health system, right? Including governments, which need to see there is not only a health benefit here, there's always a human capital benefit here. There is an economic benefit here from a critical tool like HPV vaccine. So at every level, instilling confidence and demand for, but then also understanding the drivers of a lack of demand or a lack of confidence or mis and disinformation around vaccines, which we have seen, of course, emerge across a range of what we call antigens in immunization. So really critical to address that at all levels. So I think that's one piece around confidence and demand. The other is, and we heard earlier from Dr. DeCubo and from Hannah about the Go Further partnership, but also the DREAMS initiative of PEPFAR, which really identifies, and works with those girls that are particularly at high risk. That is a very unique opportunity for us to drive in deep and say, how do we reach those girls who might not otherwise be reached by HPV vaccine if we're going through traditional channels? Maybe also to say that we in our work on the global health side of things at USAID, we're really trying to think about how do we reach girls and all children with critical immunization tools that are in those humanitarian and conflict-affected settings. I think we have a long way to go there. Leadership is, paramount here. As we can see by what has happened since the very first, I remember being here at the White House back in, I think, August of 2022, when there was this sort of first global forum of the Cancer Moonshot to now. It is incredible what this effort has done, and that is clearly the leadership of the Cancer Moonshot team, but also of the voices of President Biden and Dr. Jill Biden. And so we have been so grateful for Dr. Biden's leadership in this area, as well as that of the Organization of African First Ladies, to speak out about how their voices can be instrumental in driving change in communities and instilling confidence that we can move the needle on preventing cancer, including cervical cancer. Right. So we're just really, really impressed with that. And I want to just share this last bit, which is around a key milestone moment that's going to come up around partnership, which is in March, Gavi, the Bill and Melinda Gates Foundation, and a range of other partners, together with USAID and others, are going to be hosting a cervical cancer elimination forum in Cartagena, Colombia. This is really being spearheaded by the governments of Colombia and Spain, and we're so grateful to partner with them on that event, because I think it's going to be a moment for implementing countries to commit to reaching their girls with HPV vaccination, to supporting women to screen and get early diagnosis and treatment. And so we're just really looking forward to that as the next key milestone after this one. So very, very grateful to be here with you. Thank you.
Thank you. Thank you, Dr. Rum. And Vanessa, you represent, of course, industry, and public-private partnerships are a big driver of what it will take to get meaningfully to the goals and targets of the elimination agenda. We'd love to hear about what are Roche's commitments to this issue, and particularly how you interface with country governments to make sure that you're building in efficiencies and impact as you work directly with civil society, academics, and with country leadership.
Yeah, thank you so much for the opportunity to speak. I think we have heard a lot today about partnership and about how it takes a village, that no one of us is going to reach this target on our own. Roche is highly committed to this topic. We've been involved in innovating in the cervical cancer area, principally in the second pillar, the screening pillar of the WHO elimination strategy, around bringing technologies to the forefront that help reach patients, screen patients, and then help decide how to treat those patients and make sure they don't get lost to follow-up. What I would say is we don't do any of that on our own. I mean, whether it's running a clinical trial where you need collaborators to do that with, or thinking about systematic implementation and finding people on the ground who can help with that, if it's the Go Further partnership. And if I could just give a quick example of what this looks like. We ran a study in a city in Brazil about 18 months ago with City Cancer Care, because we saw some funny data, right? And this is back to doing tracking and tracing. the data around how many women were being reached by screening was looking really good. And it was having absolutely no impact on outcomes. And so you start saying, wait a minute, what's going on here? And so as we dug into the data, what we found was that some women were being screened multiple times a year, and some women were not being screened at all. So the population data looked great, but the patient data could use some improvement. And so it was important for us then, and important as a next step in the thought process, was to say, okay, well, that's clearly a gap. That's clearly a gap in the patient journey. What can we, as a diagnostics company, do to help fill that gap? And so that spurred us to develop a digital tool that's really aimed at providers of screening programs.
We just have just another minute or two. I'm
Sure.
sorry to cut you short.
The idea being, how do we make sure that those scarce resources that we've got now are being used in the most effective way, and that we reach as many women as possible and get as many women the benefit as possible? And I think on the industry side, we see that as part of our responsibility, to think about this as a system, and what are all the pieces and parts we bring with partnerships to that system.
Thank you. Thank you for that. And I will just say on behalf of our panel, what we hear and what we've heard is really collaboration is key. Moving across the continuum of care and high quality is key. Leadership and partnerships will get us there. And I would say to keep building on the momentum that is clearly and obviously in this room. And so thank you very much for your time.
Well, hello, everyone. My name is Catherine Young, and I serve as the Assistant Director for Cancer Moonshot Policy and Engagement. And wow, what a great event we've had. And it's all due in part because of this room filled with such incredible people. I want to just give a huge thank you to our speakers, Dr. Rathmel and Dr. DeCubo, for being here with us today. Eve and Lillian, for your words, what you really captured exactly why we are all here today, so thank you. And of course, to our expert panelists and moderators, your dedication to seeing change happen has been palpable throughout this entire event and has inspired us all, so thank you so much. I want to end this part of the forum where President Biden so often starts and where Danielle kicked us off with earlier, and that is with hope. And as Danielle mentioned, when we talk about hope, we don't mean hope in the abstract form. We don't mean hope with empty words and promises. We mean hope grounded in science. The science that was on full display today by our NCI colleagues and our academic colleagues, and that has already saved so many lives. The science that is well underway, that will create new pathways to prevent, detect, and treat cervical cancer, like the very exciting announcement we heard from Dr. Rathmel around self-collection, and the spark of new scientific ideas that are probably forming as we speak, that brings them with them the hope of possibilities. The hope grounded in the tools and the resources that we already have at our disposal, like the HPV vaccine, thanks to an entire community, many of whom have dedicated their entire careers to advancing progress, to raising awareness, to advocating for access, and never giving up in the face of so many challenges. The hope grounded in new innovation, technologies, and treatments that will serve to save the many that have yet to be diagnosed. And the hope grounded in keeping families together. Around the world, every 2 minutes, a woman dies from this disease. And it is because of statistics like these that the President and First Lady reignited the Cancer Moonshot almost 2 years ago to rally the American people and to turn hope into reality. Today brings me hope that we can end cervical cancer as we know it, and I hope you leave here feeling the same. So what does success look like for us following today? It looks like heeding the incredible ideas and advice shared by our panelists, our moderators, our survivors, our advocates, and, like Debbie reminded us, to transform those into action. It means breaking down the silos and working together as one community, as we heard such great examples of already. One of the reasons why the president included the Cancer Moonshot in his unity agenda is because cancer really does unify us all. It means making sure that the tools that we have to prevent, detect, and treat cervical cancer are made accessible to everyone who needs them, as Satish reminded us, regardless of their zip code or where in the country and the world they live. It means holding ourselves accountable, like Tamika reminded us, to keep pushing the boundaries and to keep injecting the sense of urgency that is required. And I want to thank all of you here today and watching online for doing just that, and implore you to continue doing it, knowing that you have the full support of the Cancer Moonshot behind you all the way, because ultimately, lives depend on it. Because only then can we live up to the charge that the President and the First Lady have given all of us to end cancer as we know it together. Thank you for being with us today, both here in the audience and those tuning in. And with that, this live stream will now come to a close. Thank you.